matter what grade your child is about to enter, there's always a back-to-school checklist of things you need to do.
And a visit to your family's pediatrician for an annual wellness exam and sports physical should be at the top of that list. In this week's edition of the Doctor Will See You Now, we've invited pediatrician Dr. Rishma Chand from Dignity Health Northridge Hospital Medical Center.
Hi.
Great to see you again.
Great to see you guys.
Yes. Let's start with the school physical.
Yes, school physical is an important first step in starting the year off on a healthy note. You could discuss any sort of questions you have with your pediatrician. If your child has any learning disabilities or has any behavioral issues, this is a good time to talk to your pediatrician and discuss any help that your child might need. You could do any screenings for vision and hearing, and also depression screenings if needed. And if you need to see if your vaccinations are up to date or any blood work that you might need.
All right, number of COVID-19 infections reportedly up again. When should children get a COVID-19 and flu vaccine, or should they?
I always recommend getting vaccinated. My children are vaccinated. I'll start off with the flu vaccine. I usually recommend getting it in October, keeping in mind that it takes about 2 weeks for it to be fully effective and to build full immunity. You don't want to get it too early because efficacy wanes over time. So October is a sweet spot to get the flu vaccine. As far as the COVID vaccine, that's a little bit more tricky. We're currently experiencing a summer surge. So if you've recently been infected, you could probably wait 4 to 6 months before getting the vaccine. If you haven't been recently infected, you could probably wait until the winter surge and get it then with your flu vaccine, or you can get it now and protect yourself during the summer surge.
Doctor, that flu vaccine, you can do it with a shot and possibly nasal too, or?
You can. I always recommend getting it just in the shoulder, getting the injection, but you can get nasal too.
All right, a lot of kids out there, they play sports.
Yes.
At school, sometimes with the community. What kind of screening should they be getting?
Well, if your child is an athlete and participating in sports, it's important they get their sports physical in addition to their annual visit, because things that are discussed during your sports physical are different than the annual visit. Your pediatrician will talk to you about any past medical history that you have or any family history and see if you need any further testing. They'll also do a physical exam and make sure you're fully cleared to play sports. They'll also talk to you about how to avoid common injuries that occur with each sport and talk to you about what to look out for with these injuries.
Right.
All right, transitioning from the summer sleep schedule to the school schedule. Hard for a lot of children, but it's important.
Children and adults.
Well, it's easy for the adults. Let me tell you, not a problem.
Well, I always recommend, we all know that getting enough sleep is important to help children learn, grow, function. You need sleep to help you prevent from getting sick. Not getting enough sleep has been associated with poor academic performance. It has increased rates associated with increased rates of absenteeism and tardiness. And so I always tell parents, just try to establish a bedtime routine about, start off with the routine about 1 to 2 weeks before you're going to start school. You want to have a calm, quiet, consistent bedtime routine with your children. Try to avoid using any electronic devices at night. I know that's a tough one, but I always ask parents to try to model this behavior for your children. And if you have older children and an adolescent, you want to try to charge those devices outside of their rooms so they're not tempted to use it at night.
How do you start that conversation, especially if you haven't gotten it together yet?
Well, you need to establish rules when it comes to using devices and especially social media with your children. And it's important to establish those ground rules before giving a device to your child. Let them know that you're not allowed to use a device in your room past a certain time. The charging station will be here in my living room or in our bedroom. And have those certain rules. I know some parents who turn off the internet at a certain time. So.
Oh, yes. Wow.
I can say as a parent that sometimes you don't have to say anything to them. You just give them that look.
I know. It's the mom or dad look.
That's it.
You want your phone back? Yeah, that look.
Well, thank you so much.
My
for the
pleasure.
Information. Yeah, super important. Appreciate it.
Great to see you guys.
Thank you. You too.
All right, for more information on your back-to-school health list and Dr. Chan, you can log on to dignityhealth.org.
Yeah.
Oh, didn't see the dot. Okay. .org.
You know, hearing this whole conversation just made me so glad that I grew up without smartphones, without computers. We just knew when the street lights come on, you go home or else you're in trouble.